Hi, and welcome to NRSG 1015 Clinical Experience 2. This video is going to walk you through some of the things that you will need to think about and prepare in advance for clinical. What's in this video? Well, I'm going to talk about the clinical preparedness permit, your uniform, nursing shoes, dress code, nursing skills, sort of an overview of the clinical shift and some general recommendations. So in regards to the clinical permit, each student must have a clinical permit in place. This is a requirement set out by Ontario legislation and our placement agencies. And as guests in these agencies and as healthcare professionals, it is our duty to be safe for those we care for. The requirements are detailed in the practical nursing clinical permit, are mandatory and non-negotiable. So if you do not have the clinical preparedness permit requirements by the first day of clinical, you may be excluded from attending clinical, and this can jeopardize your academic standing and success in the course. So it's really important that you have this completed. So let's talk about it a little bit more. Information about the clinical permit and some general information can be found under placement offices, and you can see the link at the top at Georgian College Student Life Student Services placement offices, and you can see in there that there's some information about how to contact the placement office and some frequently asked questions around forms, placement requirements, some video resources, and even some stuff to do with COVID. I've included some frequently asked questions directly from that site here. For example, will I be required to quit my job in order to complete clinical placement? Will I be charged extra fees if I don't have all the requirements? I have items that are expiring or not complete. What do I do? Some other things too on here is when is my clinical preparedness permit due? How long will it take me? What are the costs associated? Where do I go for first aid and CPR? And how do I upload my clinical permit? There is a wonderful video, and I have posted this on Blackboard as well too, on how to complete your Synergy permit and obtain a permit verification. You will be showing Julian Faulkner, the clinical faculty lead, your verification of clinical permit. That is, you don't show the whole 6 pages of the permit, but there will be a stamp you'll get when it's complete on this Synergy website, and you're going to send that stamp via screenshot or as a PDF document to Julian, and I will check off that your clinical permit is complete. I will talk a little bit more about this later on. Let's talk about professional appearance. Lots of questions about what should I wear to clinical and what do I need to do. So here are what you need to do. You have to have a navy blue scrub top and bottom. Light blue is for the labs, navy blue is for clinical. You can only wear navy blue uniforms to clinical. The uniform should be clean and fresh daily. They should be fit properly, be not too tight fitting, and be in good repair. Undergarments should not be visible. If you feel cold, you may wear an undershirt, but the sleeves of the undershirt must not go past your elbows. You can wear a warm-up jacket when you're on break or in post-conference, but you may not wear anything with long sleeves on the unit during care. Supportive athletic or nursing shoes with a closed heel and toe are required, and can be worn with colored socks. They can be solid colored socks as long as they're comfortable. The shoes should not have any mesh parts. The shoes should be clean and in good repair, and they should be lace up. This is important with the closed toe and heel for safety. It is expected that you will change into your uniform at the agency if possible, or if you wear your uniform to the agency, that you change into street clothes prior to leaving the agency at the end of your shift. Let's talk about some things that are not permitted. So, as far as what's not permitted, mesh shoes. So running shoes that have mesh on them, such as in the toes, are not permitted. Clogs and Crocs are not permitted. These are not safe shoes in our clinical settings. Some nurses in some settings are permitted to wear clogs or Crocs, but they are not safe for our clinical setting and we are not allowed to wear them. You should not have long sleeves, you shouldn't be wearing wristwatches, bracelets, your hair shouldn't be loose, and you should not be wearing an extremely tight uniform, be it male or female. As far as personal grooming, your hair, if longer than shoulder length, should be tied neatly back. Beard should be trimmed and neat. Fingernails should be short and clean. Nail polish and fake nails, including acrylic gel nails and UV nails, should never be worn. And the basic rationale for all of these is research has been done on these, and long nails and fake nails have been linked directly to the spread of infection and actually deaths. And this actually occurred in a neonatal unit a number of years ago, and when they started to realize that, before they realized that these nails could be a problem. Untidy hair and beards make it difficult to wear masks effectively and can look unprofessional. And also, and I've seen this happen, hair can fall into patients' wounds, so it is really important that hair is neat and tidy and tied back, regardless of whether you're male or female. Good personal hygiene is important. That is regular washing with a sort of a non-scented soap, daily, a mouthwash hygiene, and prevention of body odor is required. Do not wear perfumes, fragrances, or highly scented hair products. These can have been known to cause discomfort to patients and can trigger sensitivities, allergies, and respiratory problems. And again, it's linked to professionalism. Jewelry, rings, watches, and piercings. So jewelry, dangly earrings, hoops, or whatever should not be worn. Watches should not be worn either. Medical bracelets can be worn. Rings, if it is a plain band with no dips or curves, just a flat band, can be worn. But the basic reason for all of these is infection control and safety. So hoop earrings can be easily ripped out of ears, and that's a huge issue all around. As far as rings, they would have to be removed every time you wash your hands, and you're going to be washing your hands frequently. Watches can catch and rip patients' skin. I've seen that happen. It's horrible. The other thing too is that every single divot and crevice in those watches is a potential area where infection, little bugs can get in. So we want to prevent that. So what can we wear instead? I highly recommend the nursing watch that you can wear pinned to your chest. There's lots of these latex, non-latex sort of ones out there, and they're easily washed and cleaned and wiped off, and a plain ring on your finger is appropriate. Just a reminder, cell phones are not permitted on the unit under any circumstances at all. It does not matter if you're waiting for a call from your babysitter or anything else. You may supply the phone number to the unit that you're placed on to your care provider if needed, but you may not have cell phones on the unit. There are a variety of reasons for this. They pose a risk to privacy and confidentiality, and they're also a huge infection control risk. Cell phones are also a distraction from patient care, and it may not be intentional to be distracted, but they are. And it's always tempting to look at it if you have a down moment, or you may decide to slip into the bathroom to take a look at your phone. And let's face it, what's this nurse doing wrong? Well, she's got a personal cell phone at work on the unit. She's taking a selfie. She's got a cell phone in the bathroom. Think infection control there. She's taking pictures, which may or may not be posted to social media, but still they are likely to be shared among friends. She's wearing a wristwatch and she's got long sleeve shirts on. So there's lots of issues with that. Let's talk about our clinical preparation, just a couple of tips here. Clinical preparation, you should be completing collaborative nursing care plans and templates. They'll be found in the clinical experience course pack. You'll be doing client research on their diagnosis, their treatments, their tests, their lab works, their care plans. You will be reviewing relevant theory from these following courses: gerontological nursing theory, health assessment, and your fundamental and advanced healing arts courses. You should prepare skills cards for your assessments, wound care, catheterization, any of those things that you might want to have on hand should that opportunity present itself for you to be able to apply that skill. You will also complete any other clinical preparation assigned by your clinical placement staff. Information about this whole course, this clinical course, can be found in our clinical experience 21 course pack. And I encourage you to review this course pack before the first day of clinical. So let's take a quick look at some clinical skills. What do we do in clinical experience 2? Well, we're going to do things like reflective practice. You're going to demonstrate effective time management over the course of the 13 weeks. That should be improved upon, again, with documentation and reporting, for example, giving S-bars. You will demonstrate safety, both in infection prevention and control, but also in personal safety with, say, transferring patients, environmental awareness, risk management. Confidentiality and privacy, professional communication, leadership, teamwork, prioritization, clinical reasoning. You need to demonstrate knowledge of theoretical care of the older adult. You need to apply your health assessment learning in physical assessment and examination, and you're going to hopefully have opportunities to do infection prevention and control, nutrition intake and output, look after patients perhaps who are confused, have depression and or dementia, and then there's some other nursing skills that you may have the opportunity there. You can complete the Semester 2 Clinical Skills Checklist that's posted on Blackboard. It is a self-review. This is not your CPS who will be checking this off. This is yourself. And you will decide, are you a level 1, level 2, level 3, level 4? And you should be very honest with yourself, giving yourself more credit and saying that you're very confident at something when really you are more like a level 3. It would be more appropriate, because that just means that you know to go back and redo and have opportunities, seek out opportunities to do that skill again to improve at it. Clinical shifts. Your clinical shift will be 8 hours in length. You will have 2 15-minute breaks, 1 30-minute break, and shifts will typically begin at either 6 a.m. or 6:30 a.m. You should arrive at least 10 to 15 minutes prior to your shift. Prior to each shift, the night before, you want to make sure you get a good night's sleep. The biggest risk to your patients is failure to recognize issues, and if you are tired, you're going to be less alert and less aware of situations and subtle changes in your patients. You want to make sure that you pack lots of snacks and a good lunch for yourself. And if you're somebody who doesn't like to eat breakfast in the morning, bring something to have for breakfast, when you get your first break, or to maybe arrive a few minutes early at clinical and have your snack there. Make sure you bring your fluids as well too, your water. Pack your clinical bag the night before. You want to have a notepad, pens, flashlight or little pen light. You want to have your watch, your Georgian College crest that's going to go on the left sleeve, your Georgian College name tag, your stethoscope, any cue cards that you've prepared, and you want to make sure those are laminated so you can wipe them off, keep that infection control. You want to have your clean uniform, clean nursing shoes, your meals, your water bottle, and a change of clothing for leaving the facility. At the end of each shift, you want to make sure that you are doing some good things for yourselves. You want to make sure that you are stretching at the end of your shift. You want to make sure that you give yourself some downtime with your feet up just to rest and relax and process what you've learned and experienced throughout that shift. And then you want to get a good night's sleep. The best learning that you will get out of your shifts will be through reflective practice, and that means that you're not going in to do an 8-hour shift of work. You're going in order to grow as a nursing student. I hope this is helpful, and if you have any questions, let me know.